Your body has been warning you for months, maybe years, and you've been ignoring it because nobody told you what to look for. Pancreatic cancer kills more than 50,000 Americans every year, and the terrifying reason it's so deadly isn't because it's untreatable. It's because most people don't recognize the warning signs until it's far too late. But here's what shocks me most as a doctor. These symptoms are visible. They're happening in your body right now, and they're being dismissed as normal aging. What if I told you that the symptom almost everyone over 60 writes off as a stomach bug, or just getting older, is actually one of the clearest signals your pancreas is in crisis? Stay with me, because the 8th symptom on this list, the one hiding in plain sight that your doctor might not even connect to your pancreas, has been shown in research to appear an average of 18 months before diagnosis. 18 months. That's a window. That's a chance. And most people miss it entirely. Stay with me until the end, because the number one symptom I'm going to reveal today is so unexpected, so far removed from what you'd associate with your pancreas, that it has fooled even experienced physicians. A 2021 study published in the British Journal of General Practice found that patients who recognized this symptom early had a survival rate more than 3 times higher than those who caught it late. 3 times. That is the difference between watching your grandchildren graduate and not being there at all. I'm Dr. Sarah Mitchell, a physician specialized in senior health with over a decade of dedicated clinical experience. I've sat across from hundreds of patients over the age of 60, held their hands as they received devastating news, and watched others walk out of my office with a clean bill of health. Not because they were lucky, but because they paid attention to what their body was telling them. What I'm about to share goes against the comfortable silence that surrounds this disease. The medical community often treats pancreatic cancer as a death sentence, something you can't detect early, something you can't fight. But I've seen with my own eyes that early recognition changes everything, and I refuse to stay silent any longer. Before we go any further, if you're finding this information valuable, hit that like button right now, because this is the kind of conversation that could genuinely save a life. Now let's talk about why the pancreas is so dangerous to ignore. Your pancreas sits deep in your abdomen, tucked behind your stomach, wrapped around your spine. It has 2 enormous jobs. It produces digestive enzymes that break down your food, and it produces insulin, the hormone that controls your blood sugar. Because of where it sits and what it does, when something goes wrong with the pancreas, the signals it sends are scattered, confusing, and almost always misattributed to something else. Here's what's happening inside your body when pancreatic cancer begins. A tumor forms, usually in the head of the pancreas, the part closest to your small intestine. As it grows, it starts pressing on bile ducts, nerves, blood vessels, and digestive pathways. Every single system it touches starts misfiring, and each misfire looks like a different problem entirely. After 60, your body produces fewer digestive enzymes naturally, your blood sugar becomes harder to regulate, and your pain signals can become dulled. This is precisely why pancreatic cancer symptoms are so easy to miss in older adults. The medical community has known for decades that late detection is the primary reason the 5-year survival rate for pancreatic cancer sits below 12%. Yet, the warning signs that appear 12 to 18 months before most diagnoses are still not being communicated clearly enough to the people who need to hear them most. Until today. Here is what terrifies me most. Right now, someone watching this video has at least 2 of the 8 symptoms I'm about to describe. They've mentioned them to a friend, maybe even to a doctor. They've been told it's reflux, or stress, or just getting older. And they went home and didn't think about it again. That changes right now. Let's go through the 8 shocking symptoms of pancreatic cancer, starting from the least known and building to the one that could give you the earliest warning of all. Symptom number 8, sudden new onset diabetes after 60. Most people think of diabetes as something that builds slowly over years of poor diet and inactivity. And in many cases, that's true. But here is the dangerous exception that most physicians don't catch quickly enough. When a previously non-diabetic person over the age of 60 suddenly develops diabetes with no strong family history and no obvious lifestyle cause, there is a significant chance it is being triggered by a tumor in the pancreas. A study published in the Journal of the National Cancer Institute found that approximately 25% of pancreatic cancer patients had been diagnosed with new-onset diabetes within the 3 years prior to their cancer diagnosis. 25%, 1 in 4. The mechanism here is direct. A growing tumor disrupts the insulin-producing cells in the pancreas. The result is a sudden and unexplained spike in blood sugar, not a gradual one. Here's something most people miss. It's not just that the blood sugar is high, it's the speed at which it appears. If you or someone you love has been healthy their entire life, and suddenly, seemingly out of nowhere, blood sugar numbers are elevated and uncontrolled despite medication, that is a red flag that needs a deeper investigation. How to recognize it. Look for sudden, dramatic increases in blood sugar levels that weren't present 6 months ago. Uncontrolled glucose despite medication. Unusual thirst and frequent urination that came on suddenly, not gradually. This is a warning, not a sentence, but it requires immediate attention. Symptom number 7. Unexplained and relentless back pain. Here is where it gets complicated for older adults. Back pain is the second most common reason people over 60 visit a doctor. So, how do you know when back pain is just back pain and when it's something your spine has nothing to do with? Pancreatic cancer back pain has a specific character. It originates in the mid to upper back, often between the shoulder blades or in the middle of the spine. It does not come and go with movement the way muscular back pain does. Instead, it is persistent, dull, and boring. It often worsens when you lie on your back and improves, even slightly, when you lean forward. This is because leaning forward takes pressure off the tumor pressing against the spinal nerves. A study in Gut, a leading gastroenterology journal, found that back pain was present in over 35% of pancreatic cancer patients and appeared an average of several months before abdominal symptoms developed. This is a critical window. Back pain plus any other symptom on this list, particularly unexplained weight loss or digestive changes, should trigger an immediate conversation with your doctor about your pancreas. Do not accept "it's just your age" as an answer. Push for imaging. Symptom number 6. Greasy, pale, floating stools. I know this is uncomfortable to talk about, but this is one of the clearest, most direct signals your body can send you that something is wrong with your pancreatic function. When a tumor in the pancreas obstructs the flow of digestive enzymes into your small intestine, fats in your food are not properly broken down or absorbed. Instead, they pass through your digestive system largely intact. The result is stool that is pale or clay-colored, greasy or oily in appearance, unusually foul-smelling, and that floats rather than sinks. This condition is called steatorrhea, and it is a direct indicator of pancreatic enzyme insufficiency. Research published in Nutrients Journal found that malabsorption symptoms, including steatorrhea, were present in up to 80% of patients with tumors affecting the head of the pancreas. 80%. And yet the vast majority of patients I've spoken with never connected this symptom to their pancreas. They assumed it was something they ate. They assumed it was irritable bowel syndrome. They waited. The practical guidance here is simple. If you notice pale, floating, greasy stools that persist for more than 2 weeks, this is not something to ignore. Note when it started. Take note of whether it happens after fatty meals, and bring it to your doctor with exactly this language. The more specific you are, the faster they can act. Now I want to tell you about James. James was a 69-year-old retired engineer from Philadelphia. He came to my office complaining of what he described as a stubborn stomach issue that had been going on for about 6 weeks. He'd changed his diet, avoided dairy, stopped eating spicy food, and nothing was helping. His wife, Susan, had noticed something he hadn't. She told me, quietly, while he was getting ready in the exam room, "Doctor, his stools look wrong. They're pale and they float. I read something online, but he won't listen." That observation from Susan, a detail James had dismissed as embarrassing and irrelevant, changed everything. We ordered imaging that afternoon. The CT scan revealed a small tumor in the head of his pancreas, caught at stage 2. James had surgery 6 weeks later. 2 years on, he is cancer-free. He coaches his grandson's Little League team on Saturday mornings. He told me at his last appointment, "Doctor, Susan saved my life, and so did the fact that you took her seriously." This was not luck. This was his body sending a signal, and someone paying attention to it. And you can do the same. Before we continue, I want to ask you something directly. How old are you? Are you in your 60s, 70s, or beyond? If you've ever noticed any unexplained changes in digestion, even something you dismissed as nothing, type pancreas in the comments right now. Let me see how many of us have been ignoring signals our bodies have been sending for months. Symptom number 5, jaundice without obvious cause. Jaundice is the yellowing of the skin and the whites of the eyes. Most people associate it with liver problems, and sometimes that's exactly what it is. But in older adults, jaundice without a known liver condition or heavy alcohol use is one of the most urgent signs that the pancreas may be involved. Here is the mechanism. When a tumor grows in the head of the pancreas, it frequently obstructs the common bile duct, the tube that carries bile from the liver into the small intestine. Bile, which contains bilirubin, backs up into the bloodstream. The result is yellow skin, yellow eyes, dark urine that looks like strong tea or cola, and pale, clay-colored stools. A study in JAMA Internal Medicine found that painless jaundice, meaning jaundice without severe abdominal pain, was one of the most reliable early indicators of pancreatic cancer and was associated with earlier stage diagnosis when acted upon promptly. The critical phrase here is painless. Most people expect severe pain with jaundice, but in pancreatic cancer, the jaundice can appear quietly, without dramatic symptoms, and it can be easy to dismiss as a temporary discoloration. If you see yellowing of the eyes or skin in yourself or someone you love, this requires same-day or next-day medical attention. Not next week, now. Symptom number 4, significant unexplained weight loss. After 60, losing a few pounds without trying can feel like a blessing. But here is the truth your body needs you to hear. Unexplained weight loss, meaning 5% or more of your body weight without any change in diet or exercise within a 6-month period, is one of the most reliable red flags for serious illness, including pancreatic cancer. The mechanism in pancreatic cancer is multi-layered. First, the tumor disrupts normal digestion, meaning your body is not absorbing nutrients from food the way it should. Second, pancreatic cancer cells release cytokines, chemical signals that suppress appetite and accelerate muscle breakdown. This is called cancer cachexia, and it can cause rapid and dramatic weight loss even when a person is still eating regularly. Research published in the New England Journal of Medicine found that unexplained weight loss was present in over 70% of pancreatic cancer patients at the time of diagnosis. 70%. And in many of those cases, the weight loss had begun 6 to 12 months earlier, but had gone uninvestigated. How to monitor this? Weigh yourself consistently, once a week, same time of day, same clothing. If you notice you've lost 10 or more pounds over a few months, without trying, without a new diet, without significant illness, that number needs to be investigated. Your doctor should know. Push for answers. Symptom number 3. Persistent nausea and loss of appetite. Everyone feels nauseous occasionally, but there is a specific pattern of nausea associated with pancreatic cancer that is different from ordinary digestive upset. It is persistent. It returns day after day. It is not tied to specific foods. It is often worst in the morning or after eating, regardless of what was consumed. And it is frequently accompanied by a deep, pervasive loss of appetite that feels different from ordinary lack of hunger. It feels like food has become meaningless, like the body has simply lost interest in eating. Here's what's happening. As the tumor grows, it exerts pressure on the stomach and the duodenum, the first segment of the small intestine. This compression disrupts normal stomach emptying and creates a constant sensation of fullness or nausea. Additionally, the hormonal disruption caused by pancreatic dysfunction directly suppresses appetite signals in the brain. A study in Frontiers in Aging found that persistent nausea and anorexia were present in over 60% of pancreatic cancer cases and were among the earliest symptoms reported by patients in retrospective analysis. 60%. And among adults over 65, these symptoms were most frequently attributed to acid reflux, gastroparesis, or depression. Each of those attributions, while sometimes correct, delayed investigation by an average of 4 to 7 months. 4 to 7 months of lost time. Do not let nausea and appetite loss become background noise. If they persist for more than 3 weeks, this deserves a focused, serious medical evaluation. If you believe that paying attention to these symptoms could save your life, or the life of someone you love, type yes in the comments. If you're skeptical, type 0. Either way, your response helps other viewers see they are not alone in listening to their bodies. Symptom number 2. Sudden new pain in the upper abdomen that radiates to the back. This symptom is different from ordinary indigestion or acid reflux. The pain I'm describing is located in the upper center or upper left area of the abdomen, often described as a deep, gnawing, or boring ache. It is not sharp, it is not cramping. It is persistent, and it radiates into the mid or upper back. It often worsens after eating, particularly after fatty or heavy meals, and it can be temporarily relieved by leaning forward or curling into a fetal position. This is the pancreatic pain posture, and when a patient demonstrates it in my office, it immediately raises my level of concern significantly. The science behind this is clear. As a pancreatic tumor grows, it invades the celiac nerve plexus, a dense network of nerves located directly behind the pancreas. This nerve invasion creates the radiating pain pattern. A major review in the Journal of Clinical Oncology found that abdominal pain with back radiation was present in up to 65% of pancreatic cancer cases and was one of the symptoms most tightly correlated with later-stage diagnosis because it was so consistently misattributed to other causes, including spinal problems, kidney stones, and peptic ulcers. 65%. And most of those patients had been living with this pain, taking antacids, stretching, and waiting for it to go away on its own. I want to tell you about Patricia. Patricia was a 74-year-old retired schoolteacher from Nashville. She had been managing what she believed was a chronic back problem for nearly 8 months. She had seen a chiropractor, she had tried physical therapy, she had changed her mattress. Nothing worked. Her daughter finally convinced her to see me because she had also noticed that her mother had lost almost 15 pounds without trying and had barely touched her food at family dinners. When Patricia described her pain in my office, leaning forward slightly in her chair without even realizing she was doing it, I recognized the pattern immediately. An MRI confirmed a tumor in the body of her pancreas. Because we found it when we did, Patricia was eligible for a clinical trial. She completed treatment and is now, 3 years later, spending winters in Florida with her husband of 46 years. She told me, "Doctor, I kept thinking it was my back. I would have kept going to the chiropractor forever. My daughter refused to let me give up." That is the power of someone paying attention. And now, so are you. I want to make a simple request before we reach the number 1 symptom. If what you've heard so far seems important, and I believe it is, please subscribe to this channel, and please share this video. Think about your parents, your siblings, your friends over 60. A single share can start a conversation that changes everything. And hit that like button while you're at it. It costs you nothing, and it helps this information reach the people who need it most. And now we arrive at symptom number 1, the symptom that appears the earliest, the one most likely to give you the window you need, the one that has been documented to appear an average of 18 months before diagnosis in some patients. Symptom number 1, changes in the color and character of your urine combined with a specific new itching sensation. I know this sounds almost too simple, but hear me out, because the science behind this symptom is both compelling and, when you understand it, unmistakable. When a pancreatic tumor obstructs the bile duct, bilirubin accumulates in the bloodstream. This elevated bilirubin does 2 things that most people completely fail to connect. First, it causes the urine to darken dramatically. Not slightly, dramatically. It turns the color of dark tea, amber, or even cola, despite adequate hydration. Second, and this is the part almost nobody knows, bilirubin deposits in the skin cause a specific type of itching. Not itching from dry skin, not itching from a rash, a deep internal itching that does not have a visible skin cause and cannot be relieved by moisturizer or antihistamines. It is often worst at night and frequently appears on the hands and feet first. This combination, dark urine and unexplained skin itching without a rash, is called cholestatic pruritus, and it is directly caused by bile duct obstruction. A landmark study published in The Lancet Oncology followed pancreatic cancer patients retrospectively and found that this combination of symptoms was present in patients an average of 14 to 18 months before their eventual diagnosis. 14 to 18 months. And in nearly every case, patients had a reasonable explanation for both symptoms: dehydration, a new soap, dry winter skin, vitamin deficiency. None of those explanations were wrong on the surface, but none of them were right either. Here is what the research tells us. Itching without a rash combined with darkening urine in a person over 60 with no known liver condition should prompt an urgent hepatobiliary workup, which includes blood tests for liver enzymes, bilirubin levels, and imaging of the bile duct and pancreas. This is not a complicated test. It is available at virtually every hospital in America, but it will only be ordered if you describe these symptoms clearly and persistently to your doctor. So here is what I'm asking you to do. Look at your urine. Has it been darker than usual? Think back over the past few months. Has there been any itching, particularly at night, that you couldn't explain? If yes, these 2 things together, take a photograph of your urine in good lighting if it looks abnormal, and bring it to your doctor. Say these specific words. I am concerned about my bile duct and my pancreas. I have dark urine and unexplained itching. I want my bilirubin checked, and I want imaging. Say exactly that. Your doctor should respond. And if they don't, push harder or seek a second opinion. Your life may literally depend on it. Now let me give you exactly what you need to do starting tomorrow. This is your action plan. Start with awareness. For the next 30 days, Pay close attention to your body in these specific areas. Check the color of your urine each morning before your first large drink of water. Note it. If it is consistently darker than pale yellow, make an appointment this week. Step on a scale every Sunday morning. Same time, same conditions. If you lose more than 4 pounds in a month without trying, call your doctor Monday. When you eat, notice whether you feel nauseous, unusually full, or lose your appetite during the meal. If this happens more than 3 times in a week for 2 consecutive weeks, it requires investigation. Pay attention to your stool. If it looks pale, greasy, or floats persistently, note the date and see your doctor. Check your eyes in a mirror each morning. Any yellow tinge is a same-day medical visit. Do not wait. Examine your skin. If you notice itching, particularly at night with no visible rash, and especially if it appears on your hands and feet, add this to your list of concerns for your doctor. What to avoid. Do not dismiss any of these symptoms as normal aging. Aging changes the body, but it does not cause persistent nausea, dark urine, floating stools, skin itching, or unexplained weight loss. Do not wait for symptoms to become severe before seeking help. The entire window of opportunity in pancreatic cancer exists in the mild, quiet, easy-to-ignore stage. Do not accept vague reassurance. If your doctor says, "Let's just wait and see," about a combination of 3 or more of these symptoms, push for imaging. You have the right to advocate for yourself. Timeline of what to expect when you act. Within 1 week of reporting symptoms, you should have blood work drawn, including liver enzymes and bilirubin. Within 2 to 3 weeks, imaging such as an abdominal ultrasound or CT scan should be ordered if blood work shows abnormalities. Within a month, if imaging is concerning, you should have a referral to a gastroenterologist or oncologist. Remember this: early-stage pancreatic cancer, meaning stage 1 or 2, carries a 5-year survival rate of up to 39%. Late stage, meaning stage 4, carries a 5-year survival rate of just 3%. The difference between those two numbers is not medicine. It is time. And time is determined entirely by whether you recognize these symptoms and act. You are not broken. Your information has been incomplete. This disease is not a death sentence when it is caught early. Your body is speaking to you, sometimes quietly, sometimes in ways that look like something ordinary, but now you know what to listen for. That knowledge is not small. That knowledge is everything. I want to hear from you now. Have you ever experienced any of these symptoms and written them off as something else? Share your experience in the comments. I read every single one. Your story might be the reason someone else makes a call to their doctor tomorrow morning. Let me leave you with this. Margaret was a 77-year-old retired librarian from Boston. She had noticed itching on her hands and feet for several months. She'd tried 3 different lotions. She'd switched her laundry detergent. She'd asked her daughter, who thought it was eczema. Then, one morning, she noticed her urine was the color of dark tea, and she remembered something she'd seen in a video. She came to my office that same week. She was specific. She said, "I have dark urine and unexplained itching. I want my bilirubin checked." We found a small tumor, early stage, confined to the pancreas. She had surgery. She is well. She told me at her last checkup, "I almost didn't come in. I almost wrote it off." Almost is not good enough when your life is on the line. She came in, and that is why she is here. So here is my challenge to you. For the next 30 days, be your own health advocate. Check your urine, watch your weight, pay attention to your digestion, and if something doesn't feel right, say so, loudly if necessary. If this video helped you, please smash that like button. Subscribe to this channel for more honest health information designed for adults over 60. And share this with someone you love.